So the first speaker is Dr. Bharat Gurnani.
Yeah.
He'll be talking to us about innovative lens loading, magnified and anti-fogging solution for microscope and spectacle fogging during COVID-19.
Good evening, sir. Should I share my
Yeah,
screen?
Dr. Bharat,
Please.
yeah, please do.
First of all, I would like to thank All India Ophthalmic Society, Dr. Cheta Jadev ma'am, Dr. Rohit Chetty sir, Dr. Suven sir, and Dr. Trilmayesh sir for giving me opportunity to speak here. I'll be discussing two basic innovation on the behalf of my team. Like first one is a small, simple solution to prevent microscopic eyepiece fogging and spectacle fogging in COVID-19 era. We have no financial disclosures to make. So what are the challenges while performing surgery? Despite extensive and brisk developments in ocular surgery, surgeons continue to face recurrent fogging of spectacles and microscope eyepieces while performing surgery. Even during this COVID-19 pandemic, the surgeons are now wearing masks and face shield, and fogging seems to be a major issue. Other important issues faced like reduced stereo acuity, application of plastic tape over the surgical mask in order to avoid fogging, fogging of the teaching binoculars like side scope while teaching. Sometimes surgeons lower the upper mask strap to encourage easy breathing also. And there is sometimes need for cleaning the microscope binocular multiple times in between the surgery. So this was our problem statement. We came with a small solution, like we searched for a lot of solution. We came up this, we bought this a small medical integrate fogging solution comes by the name of Dr. Fog in the market, and there is a sponge available with it for application. So this anti-fog solution can be procured as a spray or a pre-moistened solution from the market at an inexpensive cost. And suppose this is not available, there are now a lot of local these anti-fogging solutions available, which can be easily obtained. So how to apply? The solution is applied with a sterilized dry cotton swab or sprayed directly onto the eyepieces. Then the eyepiece is cleaned with a sponge provided with the solution and allowed to draw. So how it has helped? It improves clarity by forming a uniform layer over the eyepiece. We have not seen any scratches over the optical devices. It holds good for around 5 to 6 hours, so can be used again, and like 50 to 70 applications from a bottle. Clear unobstructed view has been seen throughout the cases. The spectacle surgeons have also found it beneficial, and there is no need for plastic tape applications also. And this can be used for defogging the face shields, slit lamp eyepieces, fundus lenses, refraction, even glasses. So this simple and innovative, this is simple and innovative reproducible technique. It can help in maximizing surgical output, minimize complications during surgery, and even can be a boon for workers during the growing pandemic. The second one I'm coming is innovative intraocular lens loading magnified. So what are the challenges faced by the ophthalmic assistant or the nurse while loading the IOL? Since they don't have access to the microscope, they rely solely on their unaided vision to load the IOL. And sometimes the operation theaters are dimly lit and even they have time constraint due to surgery. So this can lead to improper loading, sudden extrusion of intraocular lens during injection, or even trailing actives getting jammed or damaged. Sudden extrusions can lead to complications like DMD, PCR, or zonular dialysis also. Other challenges faced like IOL can drop on the table or on the floor. They sometimes can be loaded upside down. And while they are loading with the naked eye, broken haptics or optics can be overlooked. Some places the surgeons are also loading the IOL. In case the ophthalmic surgeon loads the IOL, the flow of surgery will be interrupted if he has to accommodate to change the focus from surgery to IOL. If you wish to load the IOL on the surgical trolley, or the surgeon has to adjust the focus of the microscope, that is best for loading the IOL and back again. And the microscope sometimes have a smaller field of view, thus making the IOL loading difficult. So the IOL sometimes gets engaged in the cartridge, making unloading and loading also difficult. In case the IOL breaks, slips or struck, sometimes the backup IOL is not available, and then it becomes difficult to move the surgery. And even while performing high volume cataract surgery, adds to extra time during surgery. So we came up with a smaller solution. Like we obtained this magnifier from the market. It is easily available online for 700 rupees to 800 rupees. It can be attached to one side of the trolley. It has a flexible string that can be moved and can be moved towards the table. In the first image, as you can see, the ophthalmic assistant loading the IOL, and like she's injecting the viscoelastic. In the next image, she has already loaded with comfort. This image shows the magnification factor, like 3 times the magnification we get what we get from the naked eye. This also has a small LED inbuilt it, so that when the illumination is less, we can use this LED light for our benefit. And you can see how it has been attached like a jugaad. From we have taken a metal clip. There is a small hole. It can be bent. And even this we use a sterilized plastic drape to cover the metal prong, so that the sterilization part is taken care of. Thank you.
Thank you.
Sorry, you're muted.
Question?
Speaker, are you aware of how much time you allotted to speak? Thiru, do you have any idea?
So 5 minutes for speakers.
5
and
minutes.
2 minutes for discussion.
Yeah, okay, fine. So there was a question from one of the participants.
Yes,
So, and I think Divyansh, are you in? Somebody wanted to get in. You should have a link.
I'm here, sir. Yeah, yes, sir.
Yeah, so yeah, you can share your screen. In the meantime, Bharat, this solution that you talked is available off the counter, and it's basically what's its surfactant, is it? It's a soap
sir,
solution, detergent solution.
No, sir. Actually, we went onto the website. We tried to find out what exactly it is. The company has not disclosed what it is made of. Actually, we thought it was an alcoholic or maybe a sterilized. Like the contents are not available on the online. We try to search a lot what it is made of.
How much does it cost? How much does it cost?
Sir, this anti-fogging solution costs around 200 to 300, but now there are cheaper solutions available around 100 rupees. Also, we can get from the markets.
And you've tried and tested that does not damage the microscope or
yes, sir. Yes, sir. We have been using it with comfort. There is no like complaints until now.
right. Nice job.
Thank you.
I think
Thank you.
Can I ask a quick question, sir?
Yes, sir.
Sure.
So have you any experience of putting it on the biome lens for VR surgeries?
Like biome lens, we have not tried, sir. Like since like actually we had submitted this and we published this. That time the same query came from the reviewer. He asked it, but since this solution can't be sterilized, so we have not tried it on biome yet. If it in future we can sterilize it, we can try it on biome also. Probably.
Fine. Thank you.
Thank you.
If it's alcohol based and it evaporates, there wouldn't be any issue of that sterilizing part actually.
Yes.
So anyway, that I think VR surgeons will probably know their comforts